Senator Scott Jensen here, and I wanted to give you a little bit of an update as to what's going on. First off, this week we passed Sunday sales. For me, there was no real compelling reason why state government would decide what the hours are of operation for a private company, so I voted for Sunday sales. In sort of the same vein, with Real ID, I want Minnesota to be compliant. We're one of a handful of states that seems to be dragging our feet. I don't want people to have to give to the government information they don't want to have to give. So frankly, I think the legislation that Senator Pratt has introduced, allowing a choice, makes a lot of sense. If you want a real ID that allows you to fly with it, you can get that. If you don't want a real ID, you want a standard ID, you can choose that. Cost is the same. This one, you have to carry a passport if you get on the airplane. This one, you won't. Your choice. I don't really see why we would introduce concepts or discussion topics about illegal immigrants or access for illegal immigrants to driver's license. That doesn't make a lot of sense, and it doesn't seem germane. On another topic, we continue to work on healthcare reform. It's a big deal. There's no question in my mind. There is no reason that anybody that has health insurance now has to worry that their health insurance is going to be dropped. I'm absolutely committed that whatever answer we come up with, we have to make certain that we're taking care of every Minnesotan. I really believe that. I think we can do it. But there is going to be a cost, and everybody's going to have to contribute. Personal responsibility is probably going to be a part of the equation. I've been a little frustrated that some of our discussions aren't really getting at the heart of the matter. We seem to get distracted easily. I'm starting to think that's a disease associated with the Capitol. Honestly, we need to wrap our arms around why is the cost so great? I think it's because of the cost of the procedures we do and the number of times we do them. You multiply those two together and you pretty much have the cost of healthcare. So I think we need to have some hard talks on healthcare. And we're not going to be able to be politically correct or always worried about everybody's feelings. We need to be blunt, honest, and we need to solve this problem. And I guess that leads into my final thoughts. After a couple of months here, I've enjoyed it. I certainly have learned firsthand that old expression, be careful what you ask for. This isn't easy work. I'm impressed with how hard the Senate works, how hard the staff works. I'm impressed with how hard Governor Dayton works with. I'm impressed with how hard both Democrats and Republicans on both sides of the aisle work. People work hard. They really do listen. Sometimes I think we maybe legislate a little bit too much based on anecdotal stories. We need to be data-driven too, and yet we need to hear your stories. So please, keep reaching out. Let me know what you're thinking. I'm enjoying serving you. I'm enjoying serving you very much. But I sometimes wish we were a little bit more efficient down here. I don't think private business would do well if they accomplish things at the pace we seem to accomplish things here. That's from the heart. Have a great month of March. Thanks again for letting me serve you. Scott Jensen from Carver County.